Hello and welcome to our broadcast, Health and Wellness on Edel 001 TV. Your guide for this program today, my name Caleb Mungasia, and the elephant in the house, the overweight and obesity crisis. We ask the question, are you hooked? Do you know your weight? Do you know your BMI, body mass index? Are you underweight? Is your weight normal? Are you overweight? Are you obese? Or are you extra or extremely obese? It's a question that we must find an answer. Why? Overweight and obesity are among the lead causes of chronic illnesses across the world. Among the leading chronic illnesses being diabetes. We have our people who are suffering from these chronic diseases, and we must by no means assume that this is normal. This is not normal. We must do something about it. Ask yourself, when you go through pictures of our grandfathers, our grandmothers, the baby boomers, the people born from 1960s to around 1980s, ask yourself, why the difference today? Most of these people were lean. Even if you check their albums, if you happen to come across one, the men were lean and fit, and so are the women. What has changed? Something is wrong. We are not heading the right direction. And unless we make an informed decision, then we are going to be hooked to drugs forever. It's unfortunate that the mainstream media has been the number one advocate the food industry is right there next. That today, what we're eating is not food. It is something that is made to make us overweight and obese, so that later, after prolonged consumption of those things in quote, in the name of food, we develop chronic illnesses, and then we get hooked to the healthcare system, drugs, the pharma industry, forever. And that's why the Health and Wellness Program today thinks we must talk about this issue. Or maybe we are a bit fast. When is the last time you went to church and one of the presenters addressed the issue of obesity and overweight? We're living life as if it is normal, but we are stabbing ourselves. It is heartbreaking to see young boys and girls extremely fat and obese to an extent that they cannot bend to tie their shoelaces. They cannot run. And then we call that caregiver or parental love when children are perishing before our presence. We cannot continue this way. In fact, a study that features on the CDC, the Center for Disease Control and Prevention, statistics reveal that in Kenya, obesity or cases of overweight in urban areas stand at 60.3%. In the rural areas, it stands at 19%. And all indications are, as we head on moving into the future, we expect the cases to be on the rise. Recently, I walked into one of the supermarkets, and we are not mentioning names here. If you happen to visit supermarkets, you'll see it for yourself. There is a shelf that used to have farmers market. That's fresh farm produce. Although I really advocate for people going to the farmers market where you get something right from the farm. All of a sudden, there were no more foodstuffs on that shelf. Instead, guess what? They were shelving fast drinks, carbonated drinks. That is what had taken the space of fresh farm produce. But why? We ask ourselves, but why? We can rightly say that you are on your own. And decision making squarely lies within your hands, and so is accountability. It is wrong for parents to raise children with the wrong deity in the name of love. It is wrong even for ourselves to watch and continue with practices that trigger our body systems to gain weight and ultimately become overweight and obese. There's no pride in having ill health. We all know the struggles that come with ill health. We have been there, and sometimes we get there. It is not something to be proud of. But what you get from the media is, it's okay to be plus size. It's okay to live your life. Oh, we shall all die. It's all fun and games until reality knocks on your door. So you choose. Are you going to change and make your lifestyle better? Among the best gifts that we can give our loved ones is a health self. Yes, there are other ingredients that spice up life. But of what value could they be if we are in and out of hospital? For those who are affected, those who have their loved ones in such conditions, I know they understand this message better. There's no memory, there's no happiness in seeing a loved one battle with pain, battle with things that perhaps if we could have made adjustments, maybe, just maybe, we could have contained them. But we want to hear good things only. Oh, you look fine, you look good, you super. Come on, guys. Ukweli inkawa mchungu, niambie usinifiche. The truth, no matter how brutal, tell it to me. Do not conceal it. It feels nice, it feels good to be lean, to be fit. We must take pride in a healthy lifestyle. There's no trophy in being obese, fat, and overweight. There's no trophy. But I know somebody thinks and will say, you live your life, let me live my life. You are at liberty to choose the way you live your life. But we must tell you the truth. You don't need to like it. Nobody owes anybody any apology for telling them the truth. As Martin Luther King once said, we must stand together and thrive, or stand apart and perish as fools. We refuse to perish as fools. That's why we choose the truth. People who are inactive, it's called that most individuals in the rural setups are always up and down, engaging their hands, their feet, their body in movement on a daily basis. But for most who are in the urban setups and happen to be in white collar, blue collar somehow manage to have some body locomotion. Think about this. You're taking breakfast in the morning, tea with milk and sugar, some bread or some wheat product, could be chapati or mandazi or something, sorry, sorry about that. You get to the office, for those who work in offices that serve tea, at 10, again, tea and bread and something with peanut butter or jam or margarine. Lunch you eating. At 4 there's something. Then when you get home in the evening, you're eating again. Remember, you doing all this and your body is immobile. The only movement you exercise during the day is getting yourself to the stage, or maybe driving, getting to the office, going out, paying and coming back, and maybe a little movement, doing your duties, and that's all. You're making yourself vulnerable. So you're not going to come and tell us you're living your life that we should let you alone. You are our responsibility, and we must tell you what you need to do. The state of inactivity in the urban areas is wanting. We cannot live a life of home, work, food, toilet, supermarket. You can't even visit the farmer's market and buy proper food. And then you tell us we should let you to live your life. That can't work. I mean, there are people who look up to you. If you're a woman, there's a little girl somewhere who says, wow, I'm impressed. This woman has really worked hard to have her stuff together. I want to be like her. And then you're overweight. So this young girl is going to associate being obese and overweight with success. What kind of a mess is this? Worse for men. Congratulations, you are a male provider. You can lead, or at least you aspire to lead your family, your wife, your children, other than yourself. It starts with personal responsibility. We must get back to the basics. Health and wellness is not something you go and purchase. It is something that requires hard work, dedication, sacrifice. You think it's easy to deny yourself that garbage that we buy and eat in the name of food? You think it's easy? It ain't easy. It takes balls of steel to make such difficult decisions, but for the better. Let us not run away from reality. Let us accept it for what it is. Come to our senses and make an informed decision to live a better life. Dear ladies, you ain't married. You got no baby, so we associate the little fat in your body with the baby fat, and then you are here proudly walking around you're looking beautiful, the face, yeah, you're looking fine, you're looking good. But that's not all. What kind of babies do you expect to raise if you're a fat girl, an obese girl who has refused to make lifestyle adjustments? What kind of a mother do you expect to make? What kind of a wife do you expect to make? You're going to run a home, a household, and you're going to raise an unhealthy family. Remember, one of your core duties and responsibilities is to care and nurture. But if you aren't practicing that right now, how do you expect to run a healthy home? There is more than having an abode. There is more than living in a mansion. There is more than driving a nice car. There is more than having a good, well-paying career. There's more to life. And that's where health and wellness comes in. And your friends are misleading you. Your friends are telling you, girl, you're chubby, You look awesome. I mean, you are wonderful in that dress. No, you aren't chubby. You are lazy and sloppy. And you must change. Society looks up to you. You are not in the society by accident. You are there by design. We look up to you. No man feels proud having a family vulnerable to obesity and overweight conditions in the name of happiness. It could be the right time to check on our appetite. And to my fellow men, we can do better. If you know your body ain't right, do something about it. You're not going to raise demands of something yourself you cannot manage. Although it's commonly said that money overlooks appearance, but that's just money. Health doesn't give a damn about your money. It will keep you in the hospital long enough for you to learn a lesson. And again, maybe some of these decisions or the conditions that we find ourselves in, we had no power over them. But the fate is not sealed. It's not all said and done. If you come to our senses and learn and realize, hey, I think we are heading on the wrong direction, we need to make a U-turn. Do exactly that. We can all do better. Society is for all of us. Pursuing the journey of health and wellness does not make us immune, does not give us guarantee that we will never step into the hospital to seek medication. At some point, we will. It is human life. But at least if there is something we can do to minimize occurrences of such health mishaps, we can do it. We must come together as a people, enlighten one another, and the journey to health and wellness is not an easy one. It requires patience, it requires time, it requires sacrifice, it requires a helping hand. Because when you're about to give up along the journey, if you have a helping hand, somebody is going to remind you, hey, your ideal size is size 6 dress, but I see nowadays you wearing 8, 10, 12, 14, 16, 18. What's wrong? But if you say that you're going to manage it all on your own, then Chinua Achebe's things fall apart will happen. What will you do? Watch what you eat. Hippocrates, a Greek physician, once said, "Let your medicine be your food, and let your food be your medicine." Even if you can afford, there's no pride in having shelves at home full of medicine, to an extent that medicine knows your house much better than food from the farm. Not the processed and packaged things that we buy and eat in the name of food. And this decision must come from oneself. Do not buy into everything that you're told by the mainstream media. There are companies behind those ads. You think someone cares about your health? Most of these companies, in fact all of them, they care about profit. Why don't you ask yourself, why don't we watch ads encouraging us to buy sweet potatoes, carrots, yams, green vegetables? Why must it always be processed food? Don't be a fool. You can do better. Do not embrace a life of inactivity and immobility. If your day-to-day activities have minimal movement and you can manage and perhaps are located to a facility that provides physical training, enroll. It could be a gym in your town. Enroll and work out. You'll spend much less committing to pursue a ruthless health and wellness plan than you would if you are to only live on a life of medicine from daybreak to sunset. Fasting should be part of the equation. Why must you eat 4 to 5 meals in a day simply because you can afford it? Not even proper food, but things that further weaken your immunity. Why? Take charge of your appetite. And why must you eat everything? You're serving at the buffet, lined, tens of foods. And then because such opportunities are rare to come by, or simply because the organization has paid, or because you've paid, you want to eat everything. Why? Why must you be greedy? The more greedy you are, the closer you come to overweight and obesity. People, we can do better. Let us educate our parents. Let us educate the people closer to us first. It's pointless for you to parrot like a hornbill out there when you can't share the same information to the people around you. Charity starts at home. The people coined that phrase that proverb, we're not wrong. Start there, right there. Do something with your body. For heaven's sake. And drop the shenanigans of telling us your food, your choice, your body, your choice. We have a social responsibility towards each one of us. If I am unwell, I need you to hold my hand till I recover. If fate determines so. If you're unwell, you need someone to be there by your side. Why would you want someone to be there by your side when your health is falling apart, but you don't want to be on their side when they're sharing with you snippets that can make your life better? Good people, we can do better. Remember, the best gift that you can give to your people is good health. In the meantime, let us keep standing with our loved ones who are battling with chronic illnesses and do all that we can to give them the moral support, the medical care, physical support, even as we make informed decisions to run better families, a healthy people, a healthy community, a healthy nation, and a healthy world. Until next time, peace. We are gone.